We also have a touch of good news on COVID. New COVID cases and deaths are finally going down nationwide after a devastating spike in January. And yet conditions in many hospitals are still harrowing, including for medical workers who are on the front lines of the suffering. Our lead national correspondent, David Begnaud, is at a California hospital this morning where healthcare workers are also working on themselves. It includes the mental health of the doctors and nurses providing care. David, good morning to you.
Good morning to you, Tony. Look, the stress and the grief that these frontline workers are going through is really immeasurable. A lot of them are actually seeking out counseling as they're on duty. So, in fact, here in Riverside, where you've got the military working right alongside civilian staff, they have counselors actually walking the halls of the ICU, the COVID unit, looking out not only for families, but also for the nurses as they are in the middle of their job. Captain Joe Hargrave has been at Riverside University Health System for more than 3 weeks now. This Army nurse is on his third COVID deployment inside the United States.
Where are you from?
On this day, 2 of the 5 patients he was caring for took a very sudden turn for the worse. How was today? Tell me.
Today was a day. You just see them come in, they're alert, they're oriented, they're talking to you. And then just to see them decline in such a rapid rate, that was hard for me because every time you go into the room, you just kind of have to be like, okay, focus on me. Don't worry about the monitor. You're doing well. You're doing good.
Hargrave is haunted by what the virus is doing, not just to the patients, but to the families, too. Their only news about their loved one often comes over the phone. And in many cases, it's Hargrave that's connecting them. And when that person is nearing the end, only 2 family members can come in and say goodbye.
Today, a wife had 3 children, and it's like, who do you choose to come with you to say goodbye to your father? If it was my father and my mom had to make the decision about who would go with her to say goodbye, I just can't imagine that.
This virus is taking an immense toll on all of the healthcare workers like Hargrave, according to psychiatrist Matthew Chang.
This is not a plane crash or a hurricane or a shooting. The trauma, it's not just an acute one-time trauma, but it's over and over again, and that requires a different type of response.
So to help them process this trauma, the hospital has peer support specialists who spend time with critical care staff in meetings and on the floor of the ICU.
I'm always grateful for I'm so always grateful for them.
According to critical care director, nurse Tammy Lowe, even though the medical staff may have gotten better at treating COVID, dealing with it is still tough.
I know that there are staff members that have nightmares of stacking bodies, nightmares of so many patients that they can't keep up with the tasks. We're in there hearing their stories and trying to offer them any support that we can.
The peer support specialists are on the halls of that ICU 24 hours a day, just in case. Speaking of Captain Hargrave, who you saw at the top of our report, Gayle, he talked about his first day here where a man died in the ICU, and they said, okay, we got to clean it up, get the room ready, because there's somebody in the emergency department waiting to come up. And it turns out the person waiting to come up was the wife of the man who had just died. And Hargrave said, I told them we can't put her in the same room as her husband. We have to find a different room. The grief, Gayle, the grief that they feel is hard. It's hard to really detail.
Yeah, now that we've heard it, I know he can't forget it. Now that we've heard it, we can't forget it either, David. I often wonder, who is helping the people that need the help? I thought Dr. Chang said it very well when he said the grief goes over and over and over again. This is very tough to hear and see.
Endless, endless.
All right, David Begnaud, we thank you.